A rainy day with coffee in hand, a family dinner filled with the laughter of your grandchildren. In these moments, when you should feel at peace instead of relaxation, you notice something unsettling. A cold sweat, tightness in your chest, or a lingering fatigue that's been weighing on you for weeks. You might brush it off as just another part of getting older. But what if your body is whispering dire warnings about your heart health? As we turn older, it's easy to dismiss everyday discomforts as just part of the aging process. But sometimes, those little aches and pains can be signals of something more serious, like heart disease. More than 6 million people in the United States have congestive heart failure, making it the leading cause of hospitalization in those older than 65. Additionally, nearly half of all adults over 65 live with some form of cardiovascular or chronic disease, and many of these people don't experience obvious symptoms until they're in the middle of a heart attack or another life-threatening event. That's why it's crucial to pay attention to your body and recognize when it's trying to tell you something important. So what are the warning signs you should watch for to ensure you catch the disease before it catches up to you? You are sitting in a chair, the weather is cold, yet you can feel the beads of sweat forming on your brow. It might seem like just a minor discomfort, something you can brush off as no big deal, but a cold sweat could be a serious red flag for your heart. Cold sweats are often your body's way of signaling that something isn't right, possibly indicating that your heart is struggling to pump blood effectively. Do you know why the body signals the heart's health in the form of sweat? It's because when your heart isn't working as it should, your body kicks into overdrive, triggering a fight-or-flight response that can cause you to break out in a cold sweat. This reaction is your body's way of trying to compensate for the reduced blood flow, but it's also a warning sign that should not be ignored. It's easy to dismiss cold sweats, thinking they're just part of getting older or a sign of being out of shape. But did you know in about 40% of heart attacks, cold sweats are one of the earliest symptoms? So if you're experiencing them, hit up your cardiologist right away. Don't take chances with your heart. And while cold sweats may not be the most obvious signs, there are other more glaring symptoms that people tend to ignore just as much. Chest pain is one of them. Often described as feeling like an elephant is sitting on your chest, this intense pressure is a classic sign of a heart attack. But here's where it gets tricky. Not all chest pain is created equal, and it can be easy to dismiss it as something less serious, like indigestion or muscle strain. The reality is that chest pain can have many causes, but when it's severe, persistent, or accompanied by other symptoms, it's crucial to take action. To grasp the seriousness, it's important to understand that when your heart is struggling, it can't receive enough oxygen-rich blood, leading to a condition called ischemia. This lack of oxygen triggers unmistakable pain signals in your chest. But it's not just the pain itself that's dangerous. This pain is your body's urgent cry for help, indicating that your heart is in distress. Ignoring it could lead to irreversible damage. But what if it's just a false alarm? You might wonder if it's worth the hassle of seeing a doctor. But here's the thing. When it comes to your heart, it's always better to be safe than sorry. Even if the pain subsides, it could signal an underlying issue like angina, pericarditis, a pulmonary embolism, or even GERD. Chest pain can have many causes, so it's essential to get it checked out to rule out serious conditions and protect your health. This physical strain on your body may seem likely to be indicating some disease, but poor health isn't just all physical. You may have heard the metaphor that emotional pain can literally break your heart. Well, it's not just a saying. Broken heart syndrome, also known as stress-induced cardiomyopathy, is a real and serious condition where extreme emotional stress can physically impact your heart. But how does this happen? And why is it important to understand? Both happiness and sadness are natural parts of life, and it's inevitable to encounter moments when life feels hopeless and overwhelming. Whether it's the sudden loss of a loved one, a painful divorce, or receiving devastating health news, these high-stress situations don't just take a toll on your mind. They can have a profound impact on your heart as well. Broken heart syndrome often arises in response to such events, and while it's more common in women, it can affect anyone. This condition often presents with symptoms that mimic a heart attack, sudden chest pain, shortness of breath, and even a feeling of impending doom. The symptoms are so similar that many people rush to the hospital, fearing the worst. And while broken heart syndrome is usually temporary, it's your body's way of screaming for help, showing just how closely our emotional and physical health are intertwined. It's a clear signal that your heart is under significant stress and shouldn't be ignored. Studies have shown that those who experience broken heart syndrome are at a higher risk of future heart problems, so it's essential to address the root cause. Whether that's ongoing emotional stress, anxiety, or other underlying issues. So, if you ever experience sudden chest pain or shortness of breath after an emotionally intense event, don't dismiss it as just a moment of weakness. Your heart might be trying to tell you something important. Getting checked out could prevent more serious issues down the road, ensuring that your heart and your emotions stay strong and healthy. Just as broken heart syndrome can seem like a natural response to an emotional shock, other symptoms might deceptively appear as normal signs of aging, but they're anything but ordinary. Finding yourself short of breath after climbing a flight of stairs, or maybe you're unusually fatigued after a simple walk, or experiencing sudden dizziness without an obvious reason. These symptoms are easy to dismiss, especially as we age, but what if they're not just a natural part of getting older? What if they're your body's subtle cry for help, indicating that something more serious could be going on? If you've experienced any of these symptoms, comment below and let us know how you're managing them. Shortness of breath, fatigue, and dizziness are often the early, overlooked signs of heart failure. However, these symptoms can also indicate other serious conditions, such as anemia, where a lack of red blood cells can lead to fatigue and breathlessness. Chronic obstructive pulmonary disease, COPD, which affects lung function and causes difficulty breathing, or even atrial fibrillation, a type of irregular heartbeat that can cause dizziness and fatigue. Heart failure doesn't always announce itself with dramatic symptoms. Instead, it often creeps up with these minor, seemingly insignificant issues that can be easy to dismiss. But why do these symptoms that are often related to physical exercise occur as a dire warning for health? It's because when your heart isn't pumping efficiently, your body struggles to get the oxygen it needs. This leads to shortness of breath, especially during physical activity. Fatigue sets in because your muscles aren't receiving enough oxygen-rich blood to function properly, making even the simplest tasks feel exhausting, and thus leading to dizziness. The next time you find yourself out of breath after a short walk, or feeling unusually tired, don't just chalk it up to aging. Consult a doctor and get to the bottom of what your body is trying to tell you. Early intervention is the key to managing heart disease and preserving your health for years to come. But that is not all there is. Physical change in the body is another indicator of poor health. Swelling in the belly area can be easily brushed off as a sign of overeating or bloating, but it is not as harmless as it seems. When your heart isn't pumping efficiently, it struggles to circulate blood properly, leading to fluid retention in various parts of your body. One common place for this fluid to accumulate is in the abdomen, causing swelling and discomfort, a condition known as ascites. Ascites isn't just about feeling bloated. It's often accompanied by other concerning symptoms such as shortness of breath, fatigue, and a general sense of being unwell. These symptoms occur because the excess fluid in your abdomen puts pressure on your diaphragm, making it harder to breathe, and adds to the overall burden on your body, leaving you feeling drained and exhausted. But here's the catch. Ascites is not exclusive to heart failure. This swelling could also be a sign of other serious health issues, such as liver disease, cirrhosis, and even kidney disease. In some cases, ascites might even indicate cancer, particularly in the liver, ovaries, or pancreas, where tumors can cause fluid to leak into the abdominal cavity. So, what should you do if you notice unexplained swelling in your belly? Don't ignore it. Even if it seems minor, this symptom could be the first sign of a serious underlying condition. Early detection of conditions like heart failure, liver disease, and kidney disease can significantly improve outcomes and quality of life. So if the swelling in your belly is accompanied by other symptoms mentioned in the video, it's time to take a trip to the doctor's office. Remember, your body is always communicating with you, and it's crucial to listen. These 5 signs, cold sweats, crushing chest pain, broken heart syndrome, shortness of breath and fatigue, and swelling in the belly, are your body's way of warning you that your body might need help. Don't wait until it's too late. Regular checkups and paying attention to your body's signals can help you catch heart problems early, giving you the best chance at maintaining your health and enjoying a longer, fuller life. And speaking of living longer, if you're interested in learning how to improve your lifespan and live healthier, be sure to check out our next video. It's packed with tips on how to extend your years and enjoy them to the fullest.